Cora Butler, Chief Wellness Officer for Arrow Senior Living, joining you today to talk about how you can help take care of those you care about by doing your part to flatten the curve. Flatten the curve is something we've heard a lot about in the past few days, past couple of weeks, in fact. And so we're going to take a look at what it means to flatten the curve. But probably surprising to you will be that we're going to be looking back 103 years to see a very clear example of the benefit of employing social distancing, something we'll be talking more about exactly how that looks in order to do what is called flatten the curve. So you see the first case of Spanish flu occurred or was identified in Philadelphia on September the 17th of 1918. And you can see a very steep curve on that Philadelphia graph of 250 deaths per 100,000 people. And you can compare that to the St. Louis curve, where almost immediately social distancing was employed when the first case was identified on October the 5th of 1918, and social distancing was implemented on October 17th by preventing large gatherings. So here we have a very clear graph from over 100 years ago that tells us that not only is the social distancing that we're talking about today likely to be beneficial, but it was also beneficial over 100 years ago. So we also have some recent history that we can talk about. And so we have some countries such as Japan, South Korea, and Singapore who successfully contained the cases as compared to Iran and Italy. And today we're seeing multiple deaths still in Italy because those countries quickly identified the gravity of the situation and employed the public health techniques that are related to social distancing in order to control the cases. And as a result, they have had far lower case rates as well. I think that this next slide is very interesting and will give you a pictorial depiction of what that means. So without social distancing, one case can, after 1 week, become 3 more cases in that first individual infected the other 3 people. And after only 6 weeks, just 6 weeks, 1,093 cases arose as a result of that one individual case. With social distancing, and social distancing means fewer contacts, right? After 1 week, we're only seeing 2 more cases, and after 6 weeks, only 127 cases. And if we continue to take that to the next level that's possible, it can become less than 1 case. Cases. So that's why we're talking about social distancing. That's the importance of social distancing. So the 2019 and 2020 coronavirus pandemic is an ongoing pandemic, which means a worldwide epidemic caused by a particular strain of the coronavirus, and it has severe acute respiratory symptoms. And that's why we have all the conversation that we're having about ventilators and about the spread of the disease. So how does it spread? Well, it spreads between people who are in close contact with each other. And it spreads by droplets, and it's not an airborne infection. So basically, the droplets that come from our mouths when we're talking, when we're breathing, carry that virus. And it's spread by coughing, sneezing, dirty hands, and failure to observe protective measures that we're going to be talking about. We know that there can be carriers, and those carriers can transmit the disease even if they don't have any signs or symptoms that are active. And they can spread the disease through contaminated objects, high-touch objects. These can include cell phones, they can include doorknobs, elevator buttons, laptops, iPads, tablets, pens, boxes, a lot of different surfaces can catch those droplets, and the virus remains there alive for differing periods of time. So it's extremely important to do several things, and we're going to be talking about some of those things in addition to the social distancing. But the social distancing is extremely important, as is good hand washing. And we will really focus on those two issues as we go through the presentation. So here we have, again, doorknobs, we have computer keyboards, we have shopping carts, we have cell phones, we have tablets, we have iPads, we have actual paper tablets, pens, those kinds of things. So extremely important to be very mindful of hand washing, making sure then once you've washed your hands that you're not touching contaminated articles, and because the common portals of entry for this virus are the eyes, which is why you see all the healthcare workers that we're seeing in the media with face masks on, through the mouth and through the nose. So those are the common portals of entry for this. It is in the body. We have it generally settling. It's a lower respiratory infection. So it generally settles in the lungs, and we have a fever, we have cough, we have sore throat, we may have difficulty breathing, we may have general malaise like one often does with flu, we may have fatigue, those kinds of symptoms. We can also have persistent pain or pressure in the chest. There can be new confusion or an inability to arouse someone, and people may, in fact, if their oxygen in their blood is low, may have bluish lips or face. Those are all indicators of poor oxygenation that goes with. So, what can we do? How can you help take care of those that you care about? Whether it is your fellow residents, whether it is your family, whether it is the caregivers who help take care of you, we can all do this for each other. And it seems like it wouldn't necessarily be so simple, but it actually is. So you can wash your hands with warm soap and water for at least 20 seconds. And in your communities, you will see some signs and some posters about how best to do that. We avoid shaking hands with people, and that's something that is so common that it is almost a habit. And so that's a little hard to break. We talked about washing your hands with soap and water for at least 20 seconds. You also may use, if you don't have soap and water available, an alcohol-based hand sanitizer, and that needs to be greater than 65% alcohol. And then practice and observe quarantine requirements, whether it's quarantine requirements that are self-imposed or whether there's quarantine environments that you have asked. We want to avoid close contact with people. Again, we talked about social distancing. We talked about how this virus is spread by droplets. And so if we avoid close contact with people, then we won't be sneezing, coughing, and spreading that virus. We won't be spreading that virus to objects that are high touch objects that we ordinarily touch in our environment. So we can avoid close contact with ill people. We can avoid close contact with all people, staying at least 6 feet apart. And we can certainly stay home if we are ill and let somebody know who needs to know that you are ill. If that is an employee, they need to let us know they're ill. If it is a family member, we need to know that they were ill, if depending on how long ago you had close contact with them. And if it is a staff member, we are making sure that they have been screened when they come into the community. So you're going to be seeing lots more temperature taking and being asked about symptoms because we've talked about what those symptoms look like, and we're looking for that constellation of symptoms. So we're looking at all the symptoms taken together as painting a picture that tells us that you may, in fact, be affected with COVID-19. What else can you do? Well, you can cook your food thoroughly and wash fruits and veggies. So, for example, if you ordered takeout, you might have takeout or order something in to be delivered. Then you might discard the outer container, cardboard container that the food came in, and you might pop it into the microwave for 30 seconds or so. And as long as that internal temperature gets up to 70 degrees Fahrenheit, centigrade, then we are actually 70 degrees Fahrenheit, then we are more likely to see that food is not going to be carrying any viruses, because that's a common question, is why is it okay to eat takeout if I can't go to the restaurant? And again, it gets to that social distancing, but you can also have the opportunity to pop the food into the microwave and make sure that it has been reheated before you eat it. And it's also a good idea to avoid unprotected contact with poultry or animals. And so that might include wearing gloves if you needed to be in contact with poultry or animals. But one of the things that I see is people seem to think that the gloves are magic protection. So you see people wearing gloves and then touching all kinds of things, and then touching perhaps their face again, or their cell phone, and not realizing, or somebody else, and not realizing that putting on gloves alone does not protect you. Once you've worn the gloves for a while, it's no different than if you had bare hands. And then if you have symptoms or you are around people that you suspect might be possible carriers or have symptoms, then you probably are going to want to make sure that you have a mask, although we are being asked to be very judicious in our use of the masks, because our caregivers in the hospital, our nurses, our doctors in the hospital need to be able to be protected, and we know that we have a shortage, so we don't want to use. So basically what we have been talking about here is flattening the curve. So we have, in this particular case, young man saying whatever, it's just a cold or flu. And then we have the time since the first case, and we see a fairly steep curve of cases developing because that's the attitude. And then we go to the young woman on the right who is washing her hands, not touching her face, staying home when she's sick, observing social distancing, and so on. And so those are the things that it takes to flatten the curve, and why I say that you can help take care of those around you that you care about by doing your part to flatten the curve. And it's pretty simple. It's observing the social distancing. It's also washing your hands, not touching your face, staying home when you're sick, reporting when you are sick, and allowing for self-quarantine if that is indicated, and really participating in being a part of the solution as opposed to a part of the problem. So, as I said at the beginning, together we can take care of those that. So again, this is Cora Butler, Chief Wellness Officer, Arrow Senior Living, and I want to wish you well. I want to wish you safety, and I hope that this helped a bit in thinking clearly about how you can help take care of those you care about by doing just a few simple things. Thanks.